Which of the following phrase best describe the science of nursing? The answer is body of nursing knowledge. The science of nursing, the phrase of science of nursing is body of nursing knowledge. Then second question, the unique function of nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or recover. So this definition is given by Virginia Henderson. The next, the act of assisting others in the provision and management of self-care to maintain or improve human functioning at home level of effectiveness. This definition is given by Dorothea Oram. Oram, just you can remember, Oram is self-care. The next one, the definition given by Florence Nightingale mainly focus on environment. Okay, just you remember environment. Okay, here EN. Okay, environment. Here you can see environment stand with EN, and the name of Florence also contains EN. So you just remember this hint, utilizing the environment for recovery, and this definition, related definition given by Florence Nightingale. The next one, nurse encompasses autonomous and collaborative care of individual of all ages, families, groups and communities, sick or well, and in all settings. So this definition given by ICN Institute. Then next one, nursing is the protection, promotion and optimization of health and abilities, prevention of illness and injury, elevation of suffering through the diagnosis and treatment of human response. So this definition is given by American Nurses Association. The next, adaptation model of nursing with the 5 major need for human physiology was developed by the sister Costeroy. Then next, the word nurse is derived from word nutrix, nothing but nourish. My dear nursing officer, if you have any confusion in these questions, in simple way I tell you, here you can see, if definition contains sick or well, okay, then you can remember that definition is from this scientist. If a definition contains self-care, then this definition is from, nursing definition is from this scientist. If definition contains environment in it, then it is from Florence Nightingale. And if a definition, nursing definition contains collaborative care in it, then from ICN. If definition contains protection, promotion, prevention of illness in it, then the definition from American Nurses Association. So this is the simple way you can remember the definitions of nursing. Next question you can see, the knowledge based nursing practices and core skill the profession mainly depends on. The knowledge based nursing practice and core skills in this profession mainly depends on diagnosis, intervention, evaluation. Our profession mainly depends on diagnosis, intervention and evaluation. And not only that, ICN, International Council of Nurses, established in 1899. International Council of Nurses established in 1899. Then the first school of nursing was established by, the correct option is B. And not only that, in 1836 Pastor Theodor Fedner established School of Nursing in Paris in Germany, in his parish in Germany. And not only that, it is one of the first established school of nursing in world. Then Florence Nightingale also. Then after that, Florence Nightingale also established in 1860 training school. Okay, she was established in 1860 training school for nurses, Nightingale Training School for Nurses. The next one, International Day for the Nurses is celebrated on. International Day for the Nurses is celebrated on, and option B. And next one, and this International Day is celebrated on May 12th, and this May 12th is also we have been celebrating as a birthday of Florence Nightingale. The next one. Florence Nightingale was born on May 12th, 1820. Next, in 1816, Nightingale set up the first nursing school at St. Thomas Hospital in London. The next one. ICM theme for International Nurses Day according to 2023 year. Nurses, a voice to lead, invest in nursing and respect rights to secure global health. And this is the theme of International Nurses Day in the year of 2023. And not only that, here you can see different themes from different years. According to in 2023, the theme of Nurses Day is Our Nurses and Our Future. And 2022, Nurses, a voice to lead, invest in nursing and respect right to secure global health. And in 2011, a vision for future healthcare. 2010, nursing the world to health. 2019, health for all. 2018, health is a human right. 2017, achieving the sustainable development goals. Then next question you can see, in which year the Florence Nightingale Award has instituted by Ministry of Health and Family Welfare, Government of India. The correct answer is 1973. Then next question you can see, what should be done if female MLC patient is brought to the hospital with no female physician available examination. So in the hospital there is no female physician, but the patient is female, and at the time what should we do? The patient should be examined by a male physician with the female health worker present. Male physician can do the examination, no problem, but compulsory beside him the female healthcare worker should be there. Without female care worker, the male physician should not do the examination in absence of female physician. Next question you can see, which of the following is not a value essential for professional nurse? Which of the following is not a value essential for professional nurse? Dependence. Okay, so this dependence is not a essential value in professionals or essential characteristic in professionals, and rest of this human dignity, social justice, integrity. Okay, these three are essential for nurse. And dependent is nothing but relying on someone, and we can also call this is an undesirable quality. So as a nurse we should not depend on anyone, and we have our own dignity, integrity, altruism and justice. The next question, the doctrine of informed consent deal with. And all we know what is informed consent. Before doing any procedure, we should take informed consent from patient or relatives. So what is the purpose of taking this informed consent? This the doctrine of informed consent is what it contains. It contains all relevant facts about the patient, full disclosure of all the relevant facts to the patient regarding procedure. In this, clearly we inform to the relatives or any attendants about the condition of the patient along with the possible treatment and expected prognosis. The next question, the patient is in coma. Here the question you can see, the patient is in coma. So what type of consent we need to take? Answer is implied consent. Implied consent we can take from the patient who is in coma. We get the permission from the patient through the individual actions. Just we get the permission from the patient before doing any procedure. Then next one, which of the following is not an ethical principle? Which of the following is not an ethical principle? The answer is non-malfeasance. Non-malfeasance is not ethical principle. Autonomy, justice, or non-beneficence is it. These are all the ethical principles. But non-beneficence. Non-beneficence is not an ethical principle. Autonomy, justice, and non-malfeasance. So these three are the ethical principles. The next question: principles of ethical practice, including the following, except. Principles of ethical practice, including the following, except. Beneficence, justice, respect for autonomy. These three are all the ethical principles. But malfeasance, malfeasance is not a ethical principle or practice. Clearly you can see the meaning of this malfeasance. Malfeasance is nothing but harm someone. Non-malfeasance is nothing but not to harm. Not to harm. This is harm someone. And in previous question also we have seen non-malfeasance. Non-malfeasance is nothing but vacancy, not to harm. So this is an ethical principle. Malfeasance is a harming someone. Okay. Then beneficence. Here you can also see the beneficence is nothing but action to help other. Non-beneficence is nothing but doing harm. Okay. Then here you can see all the ethical principles. Respect, principle of respect, autonomy, non-malfeasance, beneficence, justice, veracity. Veracity is nothing but telling truth. The next one: all of the following are true regarding deontology. So all the following are true regarding deontology. It focuses on the consequences of action. It focuses on the study of focus on the consequences of action. We can call deontology. Is nothing but deontology. So here you can see deontology is an ethical theory, and it says the morality of action based on whether the action is right or wrong. So whatever we are studying regarding what is right, what is wrong as a morality, and that we can call the deontology. Okay, next question you can see: when a nurse enters the patient room for administering medication, she notices that the patient's food remained on the table. Helping the patient in providing food and then administering the medication is an act of. Answer is beneficence. Beneficence is nothing but doing good to the others. Okay, so here she is helping the patient in providing food. So now she is doing beneficence to the patient. And here you should not write empathy. Why? Because empathy is nothing but understanding others or understanding the patient and sharing the feelings. But here she is not sharing the feelings from the patient and not showing any concern. Just she is doing benefit to the patient to give the nothing but in providing food, and after that she can administer medication. Okay, next question. Which of the following ethical principle refers to doing good to the client? Beneficence. Already we have discussed. And here you can see the beneficence is nothing but doing good for the client. Non-malfeasance, doing no harm. And autonomy, self-determination of client. Justice, treat equally. Then nurse fails to administer correct medication to the patient. This action is known as negligence. Negligence is also one type of malpractice. Okay. And doing of something which is reasonably prudent person who not do or the failure to do something. And not only that, it is one of the crime or action of doing wrong. Other words we can also call the crime is we can also call the tort or civil wrong. And the person who commit this crime we can also call tortfeasor. Then next question you can see: an intentional touching of patient body without consent called battery. An intentional touching of patient's body without consent is called battery. The next one: immunization causes pain in child Immunization causes pain in child, but it will also provide protection against certain diseases. Which of the following ethical principle is applicable here? Which of the principle is applicable here? So justice is nothing but equally treating. Okay, and here you can see beneficence. Autonomy is nothing but self-determination. Beneficence or non-maleficence. Non-maleficence is nothing but not to harm, and here beneficence is nothing but doing good to others. Here the immunization gives pain, but after that it protecting the child from certain diseases. Nothing but here the sister is doing benefit to the child. So the answer is beneficence. Which of the following ethical principle is nursing is defined as treating all patients fairly, equally, without discrimination or without any differentiation? And the answer is justice. Justice is an ethical principle in nursing which refers to obligation to treat all the patients fairly, equally, without any differentiation. Okay, then next question. Physician ordered blood transfusion for a client, but her father refused to blood transfusion. But her father refusing blood transfusion to her child. Which among the following is an abrupt action by healthcare worker? As a healthcare worker, what you should do here? Answer is try to make the father willing for blood transfusion, get court order, do blood transfusion without listening to the father, abide by the father wishes and inform the healthcare provider. And here the answer is, here you can see D. Okay, abide the father wishes and inform the healthcare provider. Okay, and this is also one of the rule, we should not force anyone for treatment. So whatever the father is saying, we should obey that father wishes and inform the healthcare provider. The answer is D. Okay, the next question. A nurse administered wrong dose of medication to the client. Upon realizing the mistake, she immediately reported to the authority and did incidental reporting. And this shows accountability, authority, responsibility, decision making. And the answer is accountability. Okay, accountability is nothing but we should answer for our works. And we can also call self-determination. She did mistake, and for her mistake she gave an answer to authority. Then next one. Which of the following nursing action is an example of malpractice? Administering medication without proper training and certification, failing to document a patient vital signs accurately, failing to follow physician orders without proper justification, failing to follow infection control practices. And here the answer is A. Administer medication without a proper training and certification. Here the sister not have proper training and certification also. So we can call her actions malpractice, as a malpractice. And remaining options are what we discussed: failing to document patient vital signs accurately, failing to follow physician answers. So these three comes under the negligence, not a necessary malpractice. Okay, then next one. The patient right to refuse the treatment is an example of common law. Is an example of common law. The patient right to refuse the treatment is an example of, the answer is common law. Ethical principle of respect for autonomy. Then code of ethics for registered nurse defined the. Code of ethics for registered nurse defined the, and the answer is ethics. Okay, ethics is nothing but principles. Okay, the answer is principles by which nurses provide care to their clients. So when we are caring the clients, just we should follow some principles that we can call code of ethics. Then which of the following is the nurse best legal safeguard? Which of the following is the best legal safeguard? Answer is practice. Okay, competent practice is the safeguard. Okay, best legal safeguard. Then the intention of a nurse to do no harm to the patient when providing care in the ethical principle of beneficence, non-malfeasance, justice, fairness. The answer is non-malfeasance. Already we have discussed malfeasance. Malfeasance is nothing but harming someone, and non-malfeasance is nothing but not to harm. Okay, not to harm we call non-malfeasance. Beneficence is nothing but taking positive actions to help other. Okay. Next question, which ethical principle promotes self-determination by client? Which ethical principle promotes self-determination by client? And the answer is autonomy. Autonomy is nothing but self-determination the client. Non-malfeasance is nothing but doing no harm. Justice, treating equally. Fidelity means faithfulness. And overall you can see common law is nothing but patient right to refuse the treatment. Code of ethics for all is nothing but principle by which nurses provide care to their duties. Competent practice is nothing but nurses best legal safeguard. Non-malfeasance is nothing not to do harm. Then nurses best legal safeguard, competent practice. Autonomy is nothing but self-determination by the client. And here also you can see LAMA. The abbreviation of LAMA is left against medical advice. Or you can also write leave against medical advice, we can also call LAMA. The next, first response of nurse during admission. First response of nurse during admission is receive the client in courteous. The next one, MLC patient decided to DAMA. Then what we have to do? Inform the physician, chief medical officer and police. The next question, which of the following is not an attribute of a professional? Characteristics of professional. And the answer is concerned with the quantity. Concerned with the quantity is not a characteristic of professional. Then remaining, concerned with the quality of outcome, independent, self-directed. Okay, these three are qualities of professional. The next one, which values of nursing practice refers to the act of selfless concern of a nurse for the well-being of patient? Selfless. And the answer is altruism. Altruism is nothing but unselfish. Okay, so here the question they given, nursing practice refers to act of selfless, not a selfish. Concern of a nurse for the well-being of patient. The answer is altruism is nothing but unselfish. Then next, registered nurse had various right to practice and perform their sound skills in the clinical setting. Among the rights, which of the following value refers to right of self-determination? Right of self-determination already we discussed. Right of self-determination, the answer is B, autonomy. Okay, the next one, among the following professional values, which values speak about the respect for uniqueness of the individual considering their personal and cultural values? Speak about respect for uniqueness of individual considering their professional and cultural value. And the answer is D, human dignity. Then deformation that comes under the intentional torts consists of. Deformation that comes under the intentional tort, intentional wrong or intentional crime consists of. The answer is D, libel and slander. So here you can see the exact meaning of deformation. Deformation is nothing but releasing the form information about the patient character through letter or through verbally. So that we can call the deformation. The next one, act of damaging a certain person's reputation. Act of damaging person's reputation by spreading or propagating through written form or pictures through prints refers to. The answer is letter. Okay, through written through the written. So that the answer is D, libel. Okay, written letter L. Just you can remember written letter first. Okay, L and libel. The next one, the act of being responsible and answerable for whatever action a nurse does in her working environment is explained as a professional value of? The answer is accountability. Accountability is nothing but, as a nurse we should answerable for each and everything what we did in working setting, so that we can call the accountability. Then, which of the following professional values define the services that are provided by nurse that enhances the likelihood of positive outcome? The answer is quality of care. So quality of care is an professional, okay, one of the characteristic of profession which defines the care or services provided by the nurse which gives or increases positive outcome. So that we can call quality of care. Then next question you can see, the value that a nurse holds in her career for being voice for their patient and facilitates which is the best for them is known as? The answer is advocacy. The advocacy is one of the major role for the nurse, make her that enables the patient to attain their rights and benefits during the time of helplessness in their place where they got treated. So this profession is called, if the nurse maintains this profession, so that profession we can call advocacy. Then next question, which of the following is the purpose of nursing discharge summary? The answer is to provide instruction to the patient and family regarding post discharge care. Then full form of LAMA, leave against medical advice or left against medical advice. Then the primary response of a nurse during admission of client is receive the client in a courteous manner. Then next one, which should be done if a medical legal case patient decide to leave the hospital against medical advice? DAMA, discharge against medical advice. Okay. Then the answer is the physician should inform the chief medical officer and police. Okay, here you can see DAMA, full form of DAMA, discharge against medical advice. Okay, the next question, discharge planning of the patient begins at the time of admission. Then a patient who decides to leave the hospital against medical advice, LAMA, must sign a form. What is the purpose of this form? What is the use of this form? To release the physician and hospital from legal responsibility for the patient health status. The answer is A. Then disinfection of patient unit after the death or discharge of patient is termed as terminal disinfection. The answer is terminal disinfection. Then which of the following nursing action should be given highest priority when admitting the patient into operating room? Before going to operating room, as a nurse, what should we do majorly? The answer is, first we should check the patient identification, then correct operative consent. Then next question, which of the following assessment is performed after admission within a specific time to determine the nature of problem? Which type of assessment is performed after admission within a specific time to determine the nature of the problem? So that we can call the first assessment, initial assessment. After admission, what we are doing, examination or assessment, that we can call the initial assessment. By using this initial assessment only, we can guess or we can diagnose the nature of problem. The next one, what is the primary purpose of ongoing assessment? What is the primary purpose of ongoing assessment? The answer is to evaluate the effectiveness of treatment or intervention. Ongoing is nothing, continuous assessment. What is the purpose of doing continuous assessment is to evaluate the effectiveness of treatment or intervention. Which of the following assessment is conducted several months after initial assessment to determine changes in the client health status? The answer is time-lapsed assessment. So the assessment conducted for several months after initial assessment we can call time lapsed assessment. Thank you.